Hello, I'm Mary Coupland, and welcome to The Road Ahead. Through a series of guests, we are going to help navigate you on your own road ahead as you age. We will help guide you on your journey and that of your aging parents. I'm definitely of the belief that nobody should find themselves in a crisis mode simply because they didn't have access to information. I'm the publisher of Compass and Clock, a free publication, and together we are going to help you achieve your best future. Today my guest is Erin Pocuis of Cascade Hygiene. That's a tricky name to pronounce. And Erin has been a dental hygienist for 15 years. And she's got a little story. About 7 years ago, she was visiting with her grandfather at the assisted living community that he was living in Silverdale. And she would, sometimes on her visits, clean his teeth. And word started to get out that the dental office was coming to the community. And people noticed, though, that he had a change in appetite, it would improve, that he would smile more, and just his overall personality was more bubbly. So word spread quickly, and guess what? Cascade Hygiene was born 7 years ago. So it's very important and true that your dental hygiene really is priceless and changes your attitude. That's what I think. So, Erin, welcome to the show. How are you today?
I'm good. Thanks for having me on, Mary. I'm excited to be here.
Oh, yay. So why don't we tell the viewers, why is dental care so important? Just, general dental care for sure.
Well, thanks for asking. It's a really good question. Honestly, dental care is so important for so many reasons because I always say you can't have good overall health if you don't start with oral health.
Okay.
Because if you think about it, your mouth is the entryway to your whole body. So, Mary, did you brush your teeth this morning?
I did, and I flossed and I used mouthwash.
What about last night, the night before? It's pretty common that everybody has, access to care to be able to brush their teeth every day. And a lot of the patients that I see, they're not able to even, access a toothbrush and brush their teeth. So starting out your day like that is, it's not as good as if you were able to brush your teeth every day. So that's why dental care is so important. I mean, you wake up in the morning, you brush your teeth, you feel good, you feel fresh, you're ready to go. There's so many connections that, that have happened because if people aren't able to access, even a toothbrush, things start happening. Maybe you don't, feel so fresh in the morning, and then bacteria can build up and it can lead to all sorts of infections and disorders in your mouth that could be really easily prevented. So it's really...
And your breath isn't as fresh, and, then
absolutely.
maybe people are... standing back from you. And I did not tell the viewers, this is, I didn't mean to deceive you or leave out this information, but as a Cascade Hygiene, as the owner of that, Erin is not just a dental care hygienist, but she's mobile. So when she was talking about how people can't always get to the dentist, they can't always pick up a toothbrush, what she specializes in is mobile services. And so I've seen a lot of different businesses starting doing mobile services because not everybody is able to get to their dentist, let's say. Maybe they had a stroke and they're recovering, or maybe they broke their leg and they can't drive. There's many different issues. It could be dementia, etc. So here's a question for you. If you have dentures, do you need to get regular dental care?
Absolutely. I mean, I have a lot of patients that have dentures, and the reason that people with dentures still need to have dental care is because as people age, they tend to lose weight, and when you lose weight, you also lose bone density. And what happens as you lose the bone density is your jaw kind of shrinks, and the dentures can become ill-fitting. And when you have ill-fitting dentures, oftentimes they can cause rubbing, sores. I don't hate to say the C word, but I see a lot of things that, ulcers and things that can be very, very painful for these people. And if they're not getting routine dental, exams, either by a hygienist or by a dentist or some oral health care provider that's professional and trained to know what to look for, it absolutely is so important because a lot of my patients, they do have Alzheimer's or dementia, And those people can't speak for themselves. So if they have a big sore in their mouth and nobody's looking in there and they're examining to see what's happening in there, there's a lot of things that could be going wrong that could be really easily fixed by an adjustment, or a lot of the solutions can be very simple. But yeah, we need to be their advocate and go in there and really take a look and check it out. And another thing with dentures, though, is just basic cleaning. Like, a lot of people don't really, there's like a specific way to clean dentures, and sometimes the staff, at a lot of assisted living communities, they aren't always, they're very busy, but they might not know how to clean them and care for them properly. So people like traveling hygienists can help out, and dentists and all of that, and help the staff learn how to care for people's dentures and what to look for, and because it's really important, because those people have probably made quite an investment in their dentures. They're not cheap. So it's good to be able to take care of them and make sure things are fitting properly so that they don't get any oral cancers. I have actually seen several cases where I've had patients that, we've been able to get in there early enough and intervene, where there have been, major situations where people have lost maybe part of their tongue or whatnot, but we've been able to, intervene at a time where at least we were able to, resolve the issue so they weren't in any more pain. And,
So the important fact here is that they should take care of,
Absolutely.
They should have a regular visit.
Absolutely.
Whether it's at their dentist or a dental person coming to them.
Absolutely.
They should tell people if something's uncomfortable.
Right.
And you're not just a dental caregiver, but you're also an educator, so that folks that are caregivers for a loved one can, look for the signs, etc., and also help know how to take care of certain things.
Oh, absolutely. Yeah.
So when you go to a dentist, usually your insurance is accepted. Does that hold true also in the field of mobile dental care?
Yeah, absolutely. It's becoming more and more common to have mobile services of all types. Dental, dermatology, I've heard audiology, all sorts of things, because there are so many people out there that need this access to care that can't get into their car and drive to a dental office. So so dental insurance is absolutely making it easy. My company, Cascade Hygiene, takes dental insurance, and we do anything to make it easy for them, because the patients, they're paying premiums for their care, and they can absolutely use it. So yeah, and we also, a lot of places will take Medicaid also. Okay. I do, and then, private pay if they don't have dental insurance. But yeah, we do everything to make it easy for people to be able to have access to care. And sometimes people on limited incomes, people that are, retired or whatnot, don't always. Yeah, it's good. Bottom line, yeah, we do everything we can to make it affordable for
you
people.
And other services
I'm
out there.
sure, absolutely, yes.
What about, I've heard there's a connection between dementia and dental care. Can you tell us just a little bit about that? Yeah,
there have been some new studies that have been coming out where they've noticed the bacteria in your mouth. It can be very virulent and very pathogenic, and what it can do is it can cross the blood-brain barrier, which can be one of the causes of Alzheimer's and dementia. We all know, we don't know, there's not a cure for it, but we know that there are some links that have been known to play a bigger factor in it, and there are some things that we can do to possibly prevent it. So with these new studies coming out, it was pretty shocking. I mean, not super surprising, because I realized, like, how, if you think about it, how close the bacteria is in our mouth to our brain, to our bloodstream, our heart, like, it affects so many other things. So it really wasn't too surprising to notice, to learn about that connection. So yeah, it's so critical to get dental care. I mean, you can avoid heart disease, pneumonia, stroke, like all of these things just by simply getting your dental needs met, routine cleanings, intraoral cancer exams. Anybody you go to should really be looking inside your mouth, not just at your teeth, but your tongue, underneath, your palate, soft tissue, everything. I'm sorry, everything everything in your mouth. Otherwise, we don't know what's going on in there. So yeah, it's really important.
It's a dark hole.
It's a big hole,
honestly,
for
right?
sure.
So,
Yes, yes.
so oral hygiene, your mouth is the gateway
Yes.
into, you know,
Exactly.
your health care.
Yes.
But at the same time, oral hygiene is also something that's important to what everybody sees here.
Yes.
You know, it puts a smile back on your face.
Absolutely.
You know,
Confidence
it
booster.
can change your attitude.
Yeah.
So we're running out of time, so I want to make sure that we cover everything that we need to today to, you know, let folks know about these services that are out there for them that they didn't know existed. How would somebody find out about a mobile dental care person, for instance? Through their dentist? Do they search online, ask their church? How do they find people?
That is an excellent question, because it is a fairly new field, mobile dental care. A good way to find somebody would be, you know, doing a Google search for mobile dental care in your area. Always ask your dentist, you know, that you trust, that you've been going to for many years. They might know personally somebody or make a personal recommendation, because it is a personal thing to have somebody come into your mouth or care for your mom or dad's teeth, your loved ones. Like, you want to know, make sure the person is reputable, has their own malpractice insurance, and, you know, has good equipment that is prepared for the situation, because it's different than going into a dental office. I mean, a lot of my patients are medically compromised. You know, they might have aspiration issues, and you need to have good equipment. So make sure that you're doing your homework, check your references, make sure that, you know, who's coming in to care for your loved ones, that they have a good reputation, and it wouldn't hurt to be there with them. You know, I always encourage people, you know, to come in with the appointment and sit there with your mom or dad, or, you know, while we're doing the dental care.
Well, they're coming into your, not just your mouth, but they're coming into your home,
into
because
your home, absolutely.
whether you're living,
yeah,
aging in place in your own home, or whether
Exactly.
you're in assisted living, memory care, or adult family home, independent, etc.
Yeah, definitely.
Do you have any parting words you would like to share with our viewers today?
Well, thanks for listening. And yeah, I do want to just note that, explain how important dental care really is, and always try to think of it, put yourself in the situation like 20, 30 years down the road. Imagine yourself in an assisted living home, and just try to think, how would I want to be cared for? I would want somebody to care for my dental needs. I would want somebody to come in and continue doing my oral cancer screenings. I would want somebody to continue doing my dental care so I feel good. Because sometimes if you're not able to advocate for yourself, it's nice to have services like these available. And I just want everybody to know that, you know, we're here for you, and we're here to help your loved ones with their dental care, whatever they may be.
Thank you, Erin.
Thank you.
And thank you, viewers. Make sure that you're asking questions of family, friends, co-workers, neighbors, asking how are they doing? Do they need help with anything? You would be surprised for the number of services that are out there that are mobile, that can come to you. Dental care being just one of them. So until next time, have a great day, and we'll talk to you soon. Bye-bye.